Hello everyone, I am Sebit Martin and I am the Executive Director of the Community Development Center, CDC, a non-profit and a non-governmental community concern organization with roots in community media. Our mission is to work for the welfare of communities and poverty mitigation, always seeking to help the vulnerable, under-resourced, underrepresented, conflict-affected, and displaced communities by providing empowerment and creating platforms for community development. With the coronavirus or COVID-19 spreading across the globe, having cases confirmed close to us and with already best national measures taken to help prevent the spread of the pandemic, such as the close of the schools and the institution of learning, public gathering and assemblies, weddings, sporting or political events, worship centers, nightclubs, and regulations in funeral or burials, including travel bans and restrictions on the movement of people within and between several countries, the novel coronavirus has seen in communities of other countries has grievous impact, for which reason we are concerned and thought to get to you with this message, even though we pray that it won't reach or spread into our community area. Dear community, the pandemic is real and it is a kind that requires unprecedented levels of cooperation among us within the communities. Every member must take it seriously and act responsibly. We are required to change the way we live our day-to-day lives in the community, adapting good and healthy hygiene practices. And according to the World Health Organization, the best way to prevent transmission of this coronavirus is to wash your hands with soap regularly, at least for 20 seconds at every given moment, or use alcohol-based sanitizer. Practice a high level of personal hygiene. Stay indoors and practice self-distancing as much as possible by avoiding public gathering of whatever kind. Keep off weddings, churches, and keep burials short and small. Avoid the shaking of hands, hugging and kissing. Avoid any body contact. Always keep at least a meter from the next person. Avoid partaking of any cold food or drinks. Avoid unnecessary movement. Adhere to instructions and advices given by authorities or following experts' advice and guidelines from the government. I want to emphasize that in the community, we must practice this social distancing, minimize travel, work from home where possible, and self-isolate. If one person in the household develops a high temperature or continuous new cough, try not to touch your face, eyes, nose, mouth. Ensure surfaces are cleaned and disinfected, including clothing. Wear a mask if you must be around people. Community members must not panic, but remain vigilant and seek immediate medical help or attention from the nearest health facility whenever any member feels he or she have the symptoms and signs of the disease, such as dry coughing, sneezing, high fever, sore throat, and breathing difficulties. As the COVID-19 is dominating the talk in the community, misinformation and rumors as well spreading like wildfire. Because of this, our information system is helping verify these rumors that create fears and panic and encourages the community to always pay attention to only official guidelines. And through our community-centered media, we are communicating important messages about the pandemic to the community in collaboration with the community and the service providers. We at the Community Development Center, CDC, would like to wish every member of our communities health, patience, strength, and most of all, resilience during this difficult time. We urge you, please prioritize the health and safety of yourself, your loved ones, and all those around you in the community always. There has never been a greater need to come together, support each other, consider others, and be kind. I would like to hereby assure our communities that your center shall continue to serve you in the same way as we have been doing, even during this period with less or little disruption as possible, though we confidently think that depending on the situation before us, we may expect some changes to our services and the programs. I hope to communicate to you, if need be, providing you with the further updates on the situation as often as it's necessary. But always remember, we are together in this time. We are with you. Once again, stay safe and take good care of yourself. Follow official guidelines. Be strong, resilient, and protect your community against COVID-19. Together, we shall overcome and we will crush the monster. Thank you.